let's talk a little bit about something called patellar mobilizations. Now, this is the same thing as our kneecap when we're talking about the patella. Sometimes the patella gets kind of stuck and bound down after surgery, after injury, lots of different reasons why we can lose some mobility in that area. But here's how we can work on it a little bit. Now, the important part as we do this is knee position. We want to make sure that your knee is not too bent because that just binds down that kneecap again, and it's going to be pretty much impossible to get it moving the way that we want. You want to have maybe just a slight bend or all the way straight, anywhere, in that small range as you work on this. You can do this while you're sitting up in a chair with your foot supported on the floor. You can do it with your leg propped up on something, or you can do it lying, say, on your couch, sitting up and being able to reach that kneecap. The most important part is we really want to have that quad muscle nice and relaxed. So now what we're gonna do is I have my foot supported on the floor, my quad feels nice and relaxed. I wanna find my kneecap, my patella. It's gonna be this sort of upside down teardrop shaped bone right here. And normally it should move a little bit. What I'm gonna do is come in with my fingers on either side, and I'm gonna give it just a little bit of gentle pressure back and forth. Now we wanna be careful pushing it out that direction just because it's a little less stable going that way, so we typically don't push that way a lot. Most people tend to be a little bit more stiff if there's a problem going inward. So I'm just gonna use those broad finger points along either side and just kind of wiggle it back and forth. I can also find the top and bottom and try pulling it up a little bit or try pushing it down some. And we just want to get it to move in whatever way we can. Your therapist will probably direct you in specific directions that they want you to move. So pay attention to whichever specific directions they want you to work on, but this is how we actually get in there and do this technique specifically.